everybody for joining us this afternoon. Today, in addition to our regular hospital data, we're also going to cover vaccine distribution and the life expectancy news that's coming out of the CDC. But first, let's start with an update on vaccinations within our region. So, according to the CDC website, Missouri is now receiving around 97,000 doses of COVID vaccine per week. Now, that's a significant increase from the 76,000 doses we were receiving a couple of weeks ago. Now, as a reminder, the supply of vaccine is divided amongst the regions of the state by highway patrol regions and among different types of vaccinators, which are called vaccine delivery channels. St. Louis is in Region C, and we're now receiving approximately 34% of the state's supply, which comes out to around 32,950 doses per week. Now, limited supply continues to be the biggest challenge in vaccine distribution, but this increase in doses is welcome news. Now, this slide shows how many doses each of the vaccine delivery channels are expected to get if we're working with that supply of 32,950 weekly doses for our region. So you'll see the high throughput systems, which include BJC, Mercy, SSM Health, St. Luke's, and the St. Louis County Public Health Department will receive a total of 21,000 doses. 1,950 will go to a mass vaccination event, 4,000 will go to federally qualified healthcare centers, 4,000 will go to public health, and 2,000 will go to other providers. In terms of total doses administered in Region C, and so this is data that we've pulled, to date, our vaccinators in our region have administered around 311,722 total doses of COVID vaccines. So this includes vaccinations of healthcare workers, first responders, and emergency services, and high-risk individuals who are currently eligible. Now, we're continuing to report on how many doses have been administered by race as well, which you'll see on this chart here. Now, to date, 71% of doses were administered to white patients, 8% to black patients, 3% to Asian patients, and 8% to a patient of another race. Now, again, small caveat there, about 10% of the patients do not have that field filled in on the Show Me Vax database. And again, just to describe the data that's inside the database, mostly made up of healthcare workers and first responders, a smaller contribution from the more general public, so those people that are in the 1B2 categories. So as more vaccine rolls out and we get to vaccinate more of the general public, these numbers most likely will shift. But that's just to put it into a little bit of context. Now, this week, some vaccinations were delayed also because of the snowstorms, and in some cases, vaccination clinics couldn't operate because of the snow. Now, shipments of vaccine, as I'm sure you've heard in the media, were also delayed, causing some appointments to be pushed back. Now, we're confident that we can make up these vaccinations quickly and get right back on track. So if your appointment was canceled, you will be contacted to schedule a new appointment. For those waiting for their second dose of vaccine, remember that there is some flexibility with when you can receive that second dose, so don't feel like you have to hit it exactly on the mark. And you don't need to scramble to find another vaccine appointment if yours was delayed by the weather. Again, registering for vaccine. If you haven't already, we ask that you pre-register for vaccine with either a health system where you can receive care or with a local health department. Pre-registering is the first step in the process. When you pre-register, you'll be added to the vaccinators list of people who want COVID vaccine, so we can contact you when vaccine is available for you. We know there are hundreds of thousands of people waiting to get vaccine in our region, so please know that the vaccinators are scheduling patients and completing vaccinations quickly given the supply that they have. But with 33,000 doses to administer per week, it's going to take some time, obviously, to work through this very large eligible population. So moving on to what we had mentioned in the opening remarks about the CDC study. So this just recently was released, and it really shows the impact of COVID on life expectancy in the United States. This is very sad news, but it's not entirely surprising news given the impact of the virus. So this life expectancy data comes from the National Center for Health Statistics, which is part of the CDC. Their new report uses data from the first half of 2020 and shows the impact of those first months of the pandemic on the nation's health. Now, in normal years, we expect to see small increases in life expectancy, but this past year we've seen significant decreases in decline in life expectancy. And without a doubt, that is mostly driven by COVID-19. Overall, Americans statistically are living about 1 year less than they did the year prior. And the last time we saw such a large decline was actually during World War II. Now, this doesn't mean that you as an individual are going to have a shortened life expectancy. What this really should be used for is just another data point that shows the magnitude that COVID has played on our lives throughout 2020. In addition to that, it's not all populations are affected equally. We also know that Black and Hispanic Americans have died of COVID-19 at disproportionate rates. And we see this disparity in the life expectancy data as well. Where there were already gaps in life expectancy, the pandemic has caused those gaps to widen even further. Before the pandemic, we were making progress towards closing those gaps, but COVID has caused some widening of those to occur. The groups with the largest decline in life expectancy are among Black men and Hispanic men, followed by Black women and Hispanic women. Now, this is just one more data set that we can now look at and see that the pandemic has been especially devastating to people of color in the United States. So as we work to recover from the pandemic and distribute vaccines, we need to make sure that we're prioritizing people who have been disproportionately affected and make recovery process as equitable as it can be. Well, let's turn now to our hospital data. So again, this is our admissions data. It's delayed by 48 hours. Today we're reporting an admissions of 48. And our rolling 7-day average is now 43. So that 48 was a small bump up from the 30s that we were seeing in the previous days. We're hoping that's just a 1-day bump and that we'll get right back down to where we were previously, which is down into the 30s. Our next data is, of course, our hospital census data. So today we're reporting 301 patients in our task force hospitals, and the rolling 7-day average is now at 324. So this number continues to come down nicely. It will be really nice to see us break that 300 census mark as well. So hopefully those numbers will keep coming down. A little bit more detail about our census numbers. Again, we've had 301 patients in our task force hospitals. We have 78 patients that are in our intensive care units, and we have 57 confirmed COVID patients on ventilators today. On our suspected COVID numbers, again, patients waiting for a test result to come back. Today we're reporting 39 patients hospitalized with suspected COVID. We have 3 suspected COVID patients in the ICU, and we have 1 suspected COVID patient on ventilators. So really nice to get down into those single-digit numbers. And of course, our good news slide, people that have been discharged from the hospitals. Today we're reporting 62 patients discharged yesterday. Our cumulative total is 18,983 patients that have been discharged from the hospital. And again, a big shout out to all of our healthcare workers and all of the people that support them for getting these people well enough to go home. Unfortunately, we still have people passing away from COVID. Today we're reporting 6 deaths from yesterday, and our rolling 7-day average is now at 7. So still good, the numbers are coming down, but we would like it to be 0. And again, just a reference point about the deaths. The deaths, of course, are people that get sick enough to have to be taken care of in the hospital, And in order for that to happen, they have to be a case out in the community first. And so anything that we can do to decrease the spread of the virus, to decrease those case numbers, will affect those death numbers. So as we discussed at the last briefing, we're cautiously optimistic to see a continued decline in the hospital admissions and hospitalizations, but we're not out of the woods yet. There's still a deadly virus spreading throughout the community, and many of our most vulnerable loved ones and neighbors are still waiting for a vaccine. So we need to stay vigilant about prevention and stopping the spread of the virus. That means continuing to wear a mask with multiple layers, avoiding gatherings, physical distancing, and washing your hands. And please be careful when you're out and about this weekend as we clean up as well from the winter mess that's been left behind. But because of the progress, so just more of a programming note, because of the progress that we're seeing in the numbers, we're going to start reducing the frequency of our live streamed briefings. So starting next week, we're going to post the numbers every day, but we're only going to conduct our live briefings one time per week, and we'll be doing those on Wednesday afternoons. So with that, I'll go ahead and take some questions from the media.
The state of Missouri has said it is not moving teachers up in the COVID vaccine tiering system. Will the task force consider doing that in the St. Louis region or move them ahead of others in the next tier?
We can't move ahead of the state. So the state sets the tiering system, and then we follow the tiering system. So, we just have to follow what the state's guidance is on that.
As it stands now, what's your recommendation for returning to all in-person learning? Parents seem to be pushing for it more forcefully as of late.
Yeah, so that's really a discussion that has to occur between the school district and the public health department. So as you can imagine, the school districts they've been working really well throughout the pandemic in doing mitigation strategies and bringing kids back to school. But there is, differences of opinion between different school districts on how much they want to bring people back versus virtual learning. But that's really a discussion between the health district officials and the public health department. The CDC has put out guidance for what they believe should occur to bring kids back to school. And so really, though, that has to be a discussion between those two entities.
How did this week's extreme cold weather affect COVID-19 vaccine distribution? What about shipping delays? Are there still any issues?
Yeah, so there were shipping delays. Obviously, that's been in all of the major media. And so that has pushed back some vaccination clinics, as well as some vaccination clinics that weren't able to operate just because of the local conditions. So as I'm sure everybody knows, the Pfizer vaccine is shipped from Michigan, from the finishing plant up in Michigan. And so whenever air freight gets disrupted because of bad weather, that is part of the issue. But as we're getting vaccine back online, we'll be making up for those clinics, and we'll be working hard to make sure that we get all of that vaccine out the door as quickly as we can. So, yeah, it's caused some problems, but that's what weather does, and so we'll make up for it.
That concludes our list of questions received prior to today's briefing. Thanks for watching.